Hi friends, this is Dr. Aparna and welcome back to my channel. Today in this lecture, we will be discussing on the tooth numbering system. Teeth are arranged in jaws forming two dental arches. The upper arch is called as maxillary arch and the lower arch is called as mandibular arch. The two arches together constitute the dentition. Each arch is divided by an imaginary midline into a right and left half called quadrants. So in each arch there is two quadrants and total there is four quadrants, that is maxillary right or left quadrants and mandibular right or left quadrants. Humans have two sets of teeth in their lifetime. They are deciduous dentition and permanent dentition. Deciduous dentition consists of 20 teeth and permanent dentition consists of 32 teeth. Teeth nomenclature and dental formula. Denomination and number of all mammalian teeth is expressed by a formula called dental formula. Each tooth is represented by initial letter of its name. Incisor is represented as I, canine is represented as C, premolar is represented as P, and molars is represented as M. Let's look into the dental formula for primary teeth. Incisors, 2 maxillary and 2 mandibular. Canine, 1 maxillary and 1 mandibular. Molars, 2 maxillary and 2 mandibular. So in total there is 10 teeth on one side. Next comes the dental formula for permanent teeth. Incisors, 2 maxillary and 2 mandibular. Canine, 1 maxillary and 1 mandibular. Premolars, 2 maxillary and 2 mandibular. Molars, 3 maxillary and 3 mandibular. So in total there is 16 teeth on one side. Tooth numbering system. In clinical practice, some shorthand system of tooth notations is necessary for recording data. Several systems are in use around the world, but only a few are considered here. They are Zsigmondy or Palmer system, Universal system, and FDI or Federation Dental Internationally system. Zsigmondy or Palmer numbering system. It's also called as symbolic system or ADA system. In 1947, a committee of the American Dental Association, that is ADA, recommended the symbolic system as the numbering method of choice. The symbolic system for the permanent dentition was introduced by Adolf Zsigmondy of Vienna in 1861 and then modified for the primary dentition in 1874. Independently, Palmer also published the system in 1870. In this system, the arches are divided into quadrants with the entire dentition being notated as follows. The upper and lower jaw are divided into four quadrants. The deciduous teeth are represented by alphabets. You can see that it is divided into four quadrants and every quadrant starts at A and ends at E. A is central incisor, B is lateral incisor, C is canine, D is first molar, and E is second molar. So there are total 20 teeth. In this diagram, you can also see that the quadrants are represented as follows. Thus, for a single tooth such as maxillary central incisor, it is designated as follows. The Zsigmondy or Palmer notation for the permanent dentition is a four-quadrant symbolic system in which, beginning with the central incisors, the teeth are numbered 1 through 8 in each arch. 1 is for central incisor, 2 is for lateral incisor, 3 is for canine, 4 is for first premolar, 5 is for second premolar, 6 is for first molar, 7 is for second molar, and 8 is for third molar. The Palmer notation for the entire permanent dentition is as follows. Advantages of Zsigmondy-Palmer system. This system is simple to use. It is easier for beginner due to less confusion as permanent teeth and deciduous teeth are indicated differently. Disadvantages of Zsigmondy-Palmer system. This numbering system presents difficulty when an appropriate font is not available for keyboard recording for Zsigmondy or Palmer notations. And it is difficult for verbal transmission. Universal Numbering System. The ADA in 1968 officially recommended Universal Numbering System. The Universal System for primary dentition uses uppercase letters for each of the primary teeth. For the maxillary teeth, beginning with the right second molar, letters A through J, and for the mandibular teeth, letters K through T, beginning with the left mandibular second molar. The universal system notation for the entire primary dentition is as follows. In the universal notation systems for the permanent dentition, the maxillary teeth are numbered from 1 through 16, beginning with the right third molar. The teeth are numbered 17 through 32. Thus, the right maxillary first molar is designated as 3, the maxillary left central incisor as 9, and the right mandibular first molar as 30. The following universal notation designates the entire permanent dentition. Advantages of universal numbering system. Separate number or alphabet is given for individual tooth. It is easy to visualize, compatible with computers, and it can be communicated verbally. Disadvantages of universal numbering system. It is confusing and difficult to remember. It does not consider the jaw quadrant clearly, thus similar teeth are given various numerals in different quadrants. Let's move on to two-digit system, also called as FDI or Federation Dental Internationally System or bi-digit system. A two-digit system proposed by FDI for both primary and permanent dentition has been adopted by WHO and accepted by other organizations such as International Association for Dental Research. It is started to follow in 1970. The FDI system of tooth notation for primary teeth is as follows. In this system, each tooth is designated by a two-digit number. The first digit indicates the quadrant number and the second digit indicates the tooth number. For the primary teeth, each quadrant has a specific number. 5 is for upper right quadrant, 6 is for upper left quadrant, 7 is for lower left quadrant, and 8 is for lower right quadrant. The second number of the two-digit system is the tooth number. Thus, for example, the number 51 refers to the maxillary right central incisor. The FDI system for the permanent tooth is given in the diagram. Thus, as in the FDI system for primary dentition, the first digit indicates the quadrant, that is 1 to 4 for the permanent dentition and 5 to 8 for the primary dentition. 1 is for upper right quadrant, 2 is for upper left quadrant, 3 is for lower left quadrant, and 4 is for lower right quadrant. And the second number indicates the tooth number. Advantages of FDI numbering system. It is very simple, accurate, and is easy to memorize. It is user-friendly and prevents errors in differentiating left and right, upper and lower arches, and both types. It is simple to translate into computer input, simple in conversation and direction. Disadvantages of FDI numbering system. Difficulty in remembering the tooth number. Matching the specific teeth and quadrants can be confusing. In this lecture, we have discussed in detail about the tooth numbering systems. I hope it's clear to you. Please do subscribe to my channel and click on the bell icon so that you will be notified when I upload new videos. Thank you.